Do you know the difference between spider and varicose veins? Are you feeling a little self-conscious about your body or maybe a little sluggish lately? Well, the Goodman Vein and Laser Center, they can help. Here to tell you about the treatments that they have available, we have vascular specialist Dr. Robert Goodman. It's a pleasure to have you here. First, tell us a little bit about your practice. What can people expect when they meet you?
Well, our practice is dedicated to the treatment of vein disease. I've been practicing vascular surgery, blood vessel surgery since the 1980s. I trained at the Bay State Medical Center with a vascular fellowship after I completed my training in general surgery. And in 1981, I went to London and worked in a vein clinic for 6 months, learning at that point what the cutting edge was of vein surgery. Ironically, we're doing today in America what they were doing then in London. And so I've been trying to stay on top of the treatment of vein disease for at least the last 30 years.
And you do that at your practice. And I think a lot of people at home, myself included until I've chatted with you, think it's mostly a cosmetic disease and ailment. But really, vein ailments are so much deeper. Tell us a little bit about what they are and why they happen.
Well, the cosmetic part is important. It is important that you like the way that you look, but it's more important that you like the way you feel. Vein disease is very prevalent in society. 60 to 80 million people have it right now. By the time you're 50 years old, especially in women, over half the people have vein disease. The symptoms, your leg is tired, heavy, and achy. You can't wait to get home. At the end of the day, you put your feet up, you get ankle swelling, and you get the visible presentations of vein disease, the varicose veins and the spider veins.
Now, can you sometimes have the symptoms without seeing the veins, maybe if it's early onset?
Well, actually, that's an excellent question, because we see a lot of patients, they come in and they say, I don't know what's wrong with me, my doctor doesn't know what's wrong with me, I don't see anything, but my legs are killing me. And with the new ultrasounds that we have available, we can visualize the vein. It's really only an inch under the skin, and it could be very, very diseased. And if we treat that, even though you don't see anything, we're treating the medical aspect of the vein disease, and you'll get better.
Now, we're looking at a before and after picture right here. If you wouldn't mind describing kind of what we're seeing on the screen.
Well, on my left, maybe you're right. You look around the knee area, all those bulges, they're sort of a bluish color, those are varicose veins. And we've treated this patient with a laser, and on the other side, you can see that they're gone.
It's as if nothing ever happened. Now, in addition to eliminating the cosmetic, does it also eliminate most of the symptoms and the pains?
Well, that's the point. The varicose veins are actually secondary to the vein disease. It's all a pressure phenomenon. The veins bring the blood out of the legs. The arteries bring the blood into the legs. Okay. There's only two ways to get the blood out of the leg. One is to lay down and put your feet up in the air and let gravity drain the leg. That's why people put their feet up when they come home.
When you get home from work, you put your feet up on the coffee table.
And two is to walk. When you walk, the muscles in the calf literally squeeze on the vein and push the blood up the leg. And so every time you take a step, the blood goes up your leg.
And so I can imagine one of the things that you would say to your patient, just get up and get walking.
Right. We push ambulation, we push walking. So when you stop walking, why doesn't the blood rush right back down to your feet? Because one-way valve slams shut.
Huh.
So the blood goes up your leg, up your leg, up your leg. This is happening in the deep muscle system. That carries 98% of the blood out of your leg. There's a surface system, or near the skin, that carries maybe 1 or 2% of the blood out of your leg. In the people with vein disease, the valves in those surface veins, the skin veins, are broken. So now the blood is going back down the leg. And the vein is not built to handle the extra volume, the extra pressure. So what happens is the vein gets bigger and bigger and bigger. You see the varicosities to relieve the pressure. Your leg is heavy, tired, and achy because you have more volume and more pressure. I can't fix the valve, they're microscopic, but I can get rid of that surface vein. The surface vein, again, only carries 1 or 2% of the blood out of your leg, so you don't need that vein, and the vein is actually diseased, it's hurting you. So if I get rid of that surface vein with a laser, The blood now has to stay in the deep muscle veins where it belongs. It has to leave your leg, goes back to the heart, lungs, gets new oxygen, gets cleaned. So not only are we treating the actual leg symptoms, we're improving your overall circulation.
Say, it seems like it's underreported how important this is, because if you don't get these veins looked at, people oftentimes just think it's cosmetic. Health problems can build and build if you don't eradicate this situation. Now, Dr. Goodman, we're almost out of time, but if people are watching this and they're saying, whew, this applies to me, how can they get in touch with you?
Well, our phone number is 413-781-1576. We have an 800 number, 877-734-4207. And we've got a great website, goodmanvein.com, and we're available.
All the time. Dr. Goodman, thank you so much. I always learn something when you're here. It's a pleasure having you here. And if you want a consultation, you can just call Goodman Vein and Laser Center at the number the gentleman just gave you, or you can visit goodmanvein.com for a little bit more information.